Are
you ready? You ready?
Recording in progress.
Got it. Oh, I love it.
Take two.
Welcome, everybody, to our Four Amigos Ride On. I think this is part 10. Part 10 of 2000, for those who don't know, as long as we live that long. And I can promise you we won't run out of things to say, even if we repeat ourselves endlessly. So this time we decided to, I suppose, provide some tips, guidance, advice for anybody working in social or healthcare at any level, to help you work with, relate with, to, listen to anybody with dementia who you come across. Sometimes for the first time, sometimes people who you've been working with for some time, perhaps. So we'll just kick off. So anybody wants to go first?
Well, I agree to this subject because of Gail's experience recently, because that just never should have happened. So over to you, Gail. What was your, who were you meeting with?
Right, we had an appointment with my doctor because I had to go for a medical for my driving licence. So the DVLA had requested that I attend a medical with my doctor. So me and hubby went, and we entered the room, and the doctor was fine. He said, "Good afternoon." Well, it was late evening. And we sat there, and he spoke to my hubby. Yeah. And then when he asked me a question, like, how has your dementia deteriorated? I began to think, well, okay, the cooker, I'm having trouble with the cooker. So I told him that when I'm cooking a meal, that I sometimes forget when I'm opening the oven door, when I'm putting my hands in. To which he replied was, well, I don't think you should be driving. What a cooker and my driving has got to do, I have no idea. So I started getting...
Do you actually have a microwave or anything in the car?
No. Oh. I haven't got a microwave on wheels. I don't drive the microwave or the cooker. I drive my car, which is not a microwave. So I started getting a little bit agitated. And then when I wanted to say a little bit more, he sort of spoke over me, and he did that quite a few times. He also told me that I might be okay to drive today, but I could deteriorate quite rapidly, as he knows people that have deteriorated very quickly. I was, let's just say, rather depressed when I came out. And hubby says I've not been the same since, but I don't know, because I have had these down days.
So Gail, when you say he spoke over you, do you mean across you at your husband, or what?
If I was mid-conversation, he sort of cut me off the conversation and then spoke to my husband as if I wasn't able to answer the question. And when he said that I could deteriorate quite rapidly, and I said, well, I'm keeping myself busy, and I've joined these lovely groups, and I speak now in groups and tell my story, he stopped me dead and said, groups are not for everybody. People do not like these groups. Now, my doctor I thought was okay until this visit. And now I really don't want to go back, because I'm trying to encourage myself to do things and to try and keep my brain going. And this doctor, to me, is trying to do the exact opposite, to try and stop me from doing the groups and to try and stop me. Because one of the things he said was, I've noticed that you said that you go for a walk on the nature reserve every day. And I said, yes, I do. He said, but you have to drive there. And I said, yes, I do. I said, and I drive there. Are you safe to do so? So, yeah.
So, healthcare professionals, that's the scenario of how not to do an interview with someone with dementia.
Yeah, what they don't realise is how that affects us.
Yeah.
And we need things to be more positive, because if they're more positive, they encourage us to carry on living and enjoy ourselves. If they're telling us that we're going to deteriorate rapidly, we automatically, our brains think, I'm going to deteriorate rapidly.
Yeah. It's very frustrating when you hear that. I mean, far worse for you, obviously. Yeah, Dory.
I had a thing last week. Going back to 2 years ago, I went to see an audiologist.
A what?
I've said it wrong again, haven't I?
We like it that way, Dory.
You know who I mean.
And with ears.
Radiologist. Anyway, go on.
About one of them. About the hyperacusis, the oversensitivity to noise. And they just poo-hooed me at the time and said, people with dementia, that doesn't count. It's people with autism that might...
What? You mean people with dementia can't get hyperacusis?
It's not connected.
We don't count. We don't count.
No, it's not. It doesn't come along under that one of the symptoms, apparently. Anyway, there was nothing that could be done. So I come out and that was it for 2 years, because it's been locked down as well. And then a month ago, I got a letter from the audiologist.
Hearing expert?
Yes, the hearing expert. And with an appointment to go last Tuesday. So I thought, maybe they've been looking up about it. So I had to get a bus and a train to the hospital. They called me in. I sat down and she said, so what can we do for you? I said, well, I was hoping you were going to tell me what you could do for me, because you've made an appointment for me to come. Anyway, she looked back at what we spoke about before and she said, are you still having this problem? So I said, yes, and it's actually worse now. So she said, you need to keep going out into these situations. And I says, well, I do. Anyway, she said, we can offer you CBT.
Cognitive behavioural
therapy.
What, by exposing you to gunshots or something?
Yeah.
I said, I don't think. No, I said, I don't want CBT. That's not going to do anything. Anyway, she said, the outcome was, she'll see me again in a month.
Oh my goodness. And you'll go through exactly the same conversation.
Yeah, but it was a train home and a bus ride home. Yeah. For nothing.
It's quite frightening, the amount of effort we have to go to. I mean, not just people with dementia, but to actually attend these appointments. They've got to be worthwhile, haven't they? I mean, the
Yeah.
worst thing in the world is going to all that effort if you haven't got a car, and a lot of us either can't drive or it's just not convenient, or we can't afford it. So I think a message that I would want to put out to healthcare workers and healthcare system, I suppose, more, is, for God's sake, don't ask to see us and for us to travel unless it's really important and you really know what you're doing.
Yeah.
But that should apply to anybody. But
Should.
I mean, she could have put in the letter, you know, it's to talk about have you thought about having CBT or...
And then you could have cancelled.
And then I could have just...
But the fact that you turned up and she didn't know why you'd come would imply that she never thought about it. And how did that appointment ever come about? It must have been automatically triggered or something.
Yeah. And she knows I've got dementia so what can I do for you?
Yeah. I mean, that... Go on.
The thing that strikes me with healthcare professionals going into a place, a hospital or a doctor's surgery, is a lot of, I don't know if you're the same, but a lot of receptions have these computers on the wall that you have to check in. Now, this is another issue that I couldn't get quite used to, this computer thing on the wall. And even though hubby was with me, we struggled to get my name, my date of birth in there and to get a response. And it kept coming back that I didn't exist. Well, I'm beginning to think that I don't exist because I have dementia. But then again, when we went to the receptionist and I said, I'm struggling to put my details in, she looked at me as though I was stupid and said, well, it's quite simple. All you have to do is put your name and the date of birth in. Now, I have dementia. Now, I'd get a little bit mixed up and I might have put the wrong date of birth in. But on this occasion, I hadn't, because my husband was with me and he was helping me. But they've got to understand that we can't do these things. We might have forgotten his date of birth. And we might not be able to remember the first letter of his surname because we have dementia. So we do need some assistance.
And more importantly, the response should never be to anyone. Yeah. Well, it's quite simple, really, i.e. you're stupid.
You
know, that's not the way to help people.
But they also have to put themselves, they have to take their hats off for a little while and put the patient's hat on and think, how am I making them feel? You know, how would I feel if somebody had said that to me? It astonishes me sometimes how they look through their very narrow tunnel vision.
I think to some extent it's repetition for them and pressure.
It is.
You know, to be sort of fairer than I usually would like to be. And so you know, there they are doing it all the time, and they're thinking about, how do I cope with all this? How do I do this, and so on. And someone comes along and says, I can't use your system. Oh, well, it's quite simple, really. You know, I can understand why people might do that, but they have to learn not to, and have to be trained not to.
Think before they speak.
Yeah, absolutely. That's a really good point, actually. Think before you speak. The other thing I would add to that is my favourite saying: seek first to understand, then to be understood. So listen. Understand where the person's coming from.
Yeah.
Now, go on. No.
I went through an end.
What are we going for this time, Dory?
Camera down my throat.
Oh yeah. Okay. Understood.
Nausea. And gagging and vomiting.
Yeah.
And the nurse was sort of trying to explain, but she was talking a bit fast. you know, the procedure. So I said, oh, could you just repeat that, but a bit slower? I said, I've got dementia, just so she, and she said, oh, well, haven't we all? And
What?
just then, the doctor was in the corner of the room, turned round, and he went, no, she really has. And she went, oh, sorry. And I said, well, I wouldn't say I have if I hadn't. But that's not the response you should receive.
Oh my God, no. I've never heard of that happening. I mean, that is
Yeah.
just
That's a good one.
absolutely appalling.
Mm.
Gail,
Yeah.
Do you not think that sometimes they expect you to look a certain way? So
Yeah.
when we walk into the room, they expect us, when we say, well, I've got dementia because I've had this, and the reaction is totally different. So obviously, our age, because we're younger, sort of shocks them sometimes, and it is shock. You can see it on their faces. It's like, oh, you've got to, are you sure? And it's sort of,
you don't look like it.
they question the fact that you've got dementia, which, and it just, it's just mind-blowing, really. Mind-blowing.
Yes, there's almost... Go on.
Sorry, George, I keep interrupting.
Go on. I'm used to it, dear. Go on.
I forgot what I was going to say.
Oh, Gordon Bennett, it's not even worth it, is it? Okay.
Yeah.
I have dementia, George.
Oh, God.
No.
What about this? What about this business of speed of talking and how people talk to you, Wendy?
Just, I mean, it's a sentence I say the whole time, is the psychological effect of words and body language should never be underestimated by any healthcare professional.
Yeah.
You know, the way they look at you, the way they speak to you can make or break a person, as Gail's proved this, or whatever. You know, the slightest use of the wrong word, and you can crush a person.
Yeah.
Dorito.
Come on. Dorito and Amigo seem to go well together. 4 Doritos.
I was thinking then, who's Dorito?
I'm red hot. Wendy is probably, I don't know. Gail's cool chili. And what's Dory? I'm not going there. Right.
I went, when I was away, George, when we both were away that week.
When we had a little secret meeting together.
Ooh. I picked my blister pack of tablets up on a Monday.
Did it hurt?
Stop interrupting.
Sorry, I'm just illustrating. I'm trying to be a healthcare worker, illustrate how it is, you see. Go on. I won't say, I think.
So I get a blister pack weekly. I got home, opened the packets. The boxes were Buscopan, which I don't get.
That's pretty...
Buscopan, but there was no sleeping tablets. But you know the instructions you get, the directions in the
boxes.
They put them all in a bundle.
Yeah.
Well, my sleeping tablets pamphlet was there, but no sleeping tablets. So I had to get another bus, go back, queue again. I explained to the lady, and she said, well, they were sort of dispatched, signed off. And I says, well, they weren't in it. She says, well, was there a box? Was there a box in the pack? So I said, yes, but it was Buscopan, which I don't have. So she went to see the pharmacist, who came out and said, well, they have been signed off. And I said, but I haven't had them. So she says, well, we can't give you any more. So I said, look, I'm going to be away. I need them for this week. I need them for next week. So she says, well, it's your word against ours. So I said, I may have dementia, but I'm not daft. I know they're not there. So she said, the only thing you can do is go to your doctors and get him to give you another prescription.
What did she say about giving you Buscopan when you shouldn't have had it?
Yeah. And
So
also your sleeping tablets.
That's a really serious error.
Yeah.
And I said, but I've got the pamphlets in the bag for the sleeping tablets. So I says, what if somebody else, you've give them sleeping tablets to somebody else and they're not going to know. Anyway, I had to get another bus then to my doctor's surgery.
Lummy number.
You must have slept well that night.
The receptionist at the doctor's said I'd have to make an appointment for the next day
Here we go.
to see the doctor. I said, I only want a prescription. Oh, well, you've got to see the doctor. But just then, the doctor was coming through to get more files. And he said, oh, hello, Teresa, because I'd been there a few days before. What's the problem? Anyway, I explained. And he just wrote me out a prescription. Then I had to get a bus back
to the chemist.
And then another bus back home. Took me all day. But the worrying thing, well, I didn't like her attitude, the pharmacist. It's your word against ours. And worrying that somebody else got them sleeping tablets.
So you remind me of something else that I feel quite strongly about. And that is that people with cognitive challenges, difficulties, cognitive impairment, I should say, whether it's caused by dementia or anything else, I believe should have easier access to healthcare, like GPs, for example.
Yeah.
I went to talk with a GP at my practice about the having put in a complaint on purpose in order to get the conversation about the consultation, the e-consultation forms that we have to fill in if we want to get anything or see anyone. And, you know, we've got the standard EMIS one, which is probably used in a lot of the country, but not everywhere. And it takes you through so many repetitive questions. And, you know, you explained in the first box why it is you want to advice or to see a doctor. And then you go through all the rest of, you know, have you got heart pain? Are you bleeding? Are you bruising? All that every time, regardless of what you put in the first place. And then you go a little bit further and say, please tell us a bit more about why you want to see this. And think, I've bloody done that already. So I nowadays have learned to put as above and move on. And I know that if I lose my rag and my desire to live when I'm trying to fill these damn things in, especially sometimes you get a crash and the whole thing disappears. How is it if I was really feeling ill? How would I do it then? And, you know, the alternative is you ring. And if you ring, of course,
don't get an answer.
You have to go through the 1, 2, 3 system and then wait for 15 minutes or more with this bloody music going. And then the first thing that she says is, you need to fill in an e-consult form. No, I've tried. Or no, what I asked my GP for was to have a simpler shortcut process for those who need it. And the answer was, oh, we can't do that for you. We can't do that for people with dementia because it wouldn't be fair to everybody else. And I'm thinking, what about equity of access? What about, we should be making it as simple as possible for people instead of effectively putting it right down so we can't do it at all. Wendy?
Yeah. I'd had this discussion with my GP practice for the last 2 years, and especially during COVID, because the only way you could contact them was by phone. You couldn't even go in to see a receptionist. You had to contact by phone. And of course, I can't use the phone. It's now, I mean, it did take me a long, long time and a lot of hassling. But now we have a wonderful system where I just email the practice, tell them what's wrong. They pass it on to my doctor's secretary, who then decides what to do with it, what I need to have done. And I'm now allowed face-to-face meetings. I can email about anything because it goes straight to a secretary. And it's so much easier for them. It's so much easier for me. And it doesn't cost them any more time.
No.
The time
it actually probably costs them less. Yeah.
And also,
I know.
Again, it's taken me a long time to get there, and we've all had these experiences that we shouldn't have. But I've been very lucky in that I've had a GP that will listen. And now I always have a double appointment, just automatically. She knows I always take my little pad with everything written on that I want to say. And she will always take it from me at the end and write out what we talked about.
Wow.
What we've done. So, it's a win-win.
You've done the training.
Yeah. So that is how to have a consultation with someone with dementia.
Yeah, well said. Gail?
Yeah, I don't know if anybody else has had this experience, but I once went to see my neurologist and I went on my own and I was seriously told off because I'd gone on my own.
You'd gone on your own. I was just going to say that.
Yeah, I'd gone on my own. And it's as if once you've received that diagnosis, you're not allowed to do anything on your own, especially go to a doctor's or to a hospital. And I think I'd only received my diagnosis in the February, and I'd gone to see the neurologist, I think, a couple of months later. So it was months. So I hadn't deteriorated any. I knew where the hospital was. I knew how to get to the hospital, and I can still speak for myself. And I take a pad with me, and if I need to jot anything down, I will do so. And it was if I was being pulled up for doing that, as if I didn't have the capacity to be able to do that. And that is another thing that it sort of makes you feel quite low, because it makes you feel as though you shouldn't be doing it. And I do find that most medical people that I have seen over the last few years have made me feel like that. And I'm getting to the point now where I don't even want to go and see anybody in a hospital or a doctor's because of how they make me feel.
Yeah.
I stopped going to the hospital. I stopped going to see my neurologist for that very reason. Because nothing changed, no matter what I said, no matter, I even told them how they'd made me feel. The next time they made me feel just the same. So I just refused to go anymore. When I got another follow-up, I just got my daughters to cancel it and say why. Because I'm not prepared to put myself through that. If they're not going to bother to listen and react in a different way, then I'm not going to bother to turn up and be verbally assaulted each time, because that's what it feels like.
Yeah.
It's just a constant battle. Everything feels like a constant battle. It shouldn't be like that.
No, it
And
shouldn't.
then earlier on, it made me feel like, have I had a wrong diagnosis then?
Yeah.
If they're thinking I shouldn't be doing this, maybe I haven't got dementia and I've been misdiagnosed.
Well, in fact, the misunderstanding, literally the misunderstanding of it all is on their part. Because the people who gave you the diagnosis, one trusts, knew what they were doing. And they didn't go on what they saw, they went on what they found when they did the tests and so on.
Yeah.
I must say, I was thinking, was it yesterday sometime or overnight? I was thinking about this business of, we get a diagnosis and the dear old medical profession doesn't have a cure for us. They do have a few drugs that can sometimes alleviate things for us, for some people. And it really is, it feels as if we just don't matter anymore. As if there isn't something they can do, they don't want to know. And I think they should be always asking, anybody who sees you should be asking how we are, how we're getting on. It's like every carer should also be asked that whenever they see any healthcare or social care person. There should always be that little opportunity given to offload if someone needs it.
You're quite right, George, because they need to learn to step back from their clinical world and venture into, the human world, which is their own world outside the medical.
And ask that question, and what else? And how else? What else is troubling you? Is there anything? Is there anything else? Keep asking it.
That's a good one. Where did we hear that, George? That was recently.
Said if you ask somebody if they're okay, they will go, I'm okay.
Yeah, fine.
But if you ask them again if they're okay, and I learned this through the counselling, the reaction will change because they're thinking about it. And in the end, they normally say, no, I'm not okay, or they'll break down because they're not okay.
And I think it's also because if they ask it twice, you feel convinced that actually they really do want to know. And they're prepared to listen. And Wendy, I can remember where the what else thing came from. It was Susie Webster who found it. She probably told us at a Elite meeting. Because she suddenly found a new GP who visited them and gave them lots of time and kept on saying, and what else, and what else. And it really gave them the opportunity to go through the whole gamut of stuff that they were trying to live with, but was difficult.
If somebody asks you if you're okay or how you're feeling, I don't know, it just changes everything because it makes you feel that you're a person and that you're important. But when you go to a doctor's surgery and you're talked over, you don't feel important, and you feel like, well, is there any point? Because you just feel like you're a nobody now because you've got this dementia that people aren't interested anymore, especially the medical profession. That's how I felt.
You're actually a trouble to them rather than...
Yeah, we can't cure you. We don't want to know.
Yeah, go away.
Dorito.
They should be able as well to be able to see the same doctor. I have never seen the same doctor twice.
No. And that's where I'm lucky again. It's on my notes to always see the same doctor.
Yeah, and it should be.
Yeah.
You can tell they haven't even looked at your notes. You know.
So, we're getting on in time. So, any other thoughts about what we would like to tell?
I would just say time, language, and body language. And the biggest one,
and of course, try not to ask a direct question out of the blue, because actually we probably won't be able to answer it very quickly or at all.
Yeah, because I saw this other GP, as I say, I never get to see the same one. And she asked me something, my postcode or something.
No.
And I said, well, I can't remember, I've got dementia. And she got my notes up, but it mustn't have said anything. And she just said, oh, so sorry.
Words again, words.
I don't know where they get these GPs from.
It's difficult. I think I'm going to actually come to the defence a little bit, because if someone, I mean, you've got to say something, and if they say it in the right tone, not as if, oh my God, your life's over, so sorry. Like
they could say.
They could be apologising for themselves, you know.
They could say,
stupid thing for them to say.
And how does that affect you?
Yeah.
Or how are you managing that? Or
That's right. Yeah.
Not just, sorry.
Yeah. but I'm sure it's where training comes in, isn't it? It's very easy to slip into saying the wrong thing without meaning to offend.
Yeah.
What they need to do is to learn ways of communicating which won't offend, but which will support.
Yeah.
And smile.
Yeah, definitely.
God, smile. Please smile. Even if you're thinking of committing suicide, please smile. You do it. Because it makes a big difference.
Yeah.
But going back to training, that's where that it's totally medically focused. You know, they have little exposure to people's lives, of how it is to live with any diagnosis of anything. You know, so if they meet someone with diabetes, they know what to check, and they know how someone will be if they eat the wrong thing, do the wrong thing.
I think younger GPs now, people coming through out of training now, probably do have a reasonable amount of exposure like that. I mean, they spend quite a lot of time sitting in consultations, but just watching and listening, and I may be doing them more service than I should do, but I think they probably start life, most of them, with understanding and intent, you know, and they understand body language, etc. And you know, we all meet such wonderful people. It's just a shame we also meet these other so-and-sos who either they never knew, or they have just become so hardened they need to have a year out and go and do something else and then come back.
We were talking about that very thing this morning, and I was saying how, you know, when we all see students and trainees, they're so enthusiastic and so willing to learn.
Yeah.
Once they're in the system, it's that pressure that the system puts on them that seems to blank out the human part of treating people.
Whereas GPs have a different role. You know, they have to see the whole person. And to see the whole person, you've got to listen to the whole person.
Yeah.
And take time to get to know them.
Yeah.
And I don't envy them. It's not easy, but they did go into it.
Yeah.
Because they believed in it, and we are their patients.
And my GP, the way I've turned her around, has proved that it can be right.
Yeah.
It can be put right. You've just got to want.
You've got to be Wendy, basically.
Do the best.
Sister Wendy with her spear. Laodicea. And I think probably the onus is on us to try and change the system and to be a bit more active in doing that. But very few people can do it.
No, well, that's where it comes back to the training and expectation, though.
Yeah.
Not everybody has the personality to be smiley and friendly.
Yeah, Gail.
Yeah, on about how we talk to doctors and professional people. I once did a talk at the memory clinic, and I'd wrote a poem about my diagnosis. And I was asked if I would read this poem out at this. It was like a little conference and all get together and people were saying different things. And I said, yes, I'd love to read my poem out. And a lady contacted me and said, you know that lovely poem that you wrote about your diagnosis? I said, yes. She said, well, please, can you take some of the wording out? And I said, sorry. She said, because it might offend the doctors that are coming to this meeting. I said, no, I'm not taking anything out of my poem because that's how I've wrote it, that's how I saw it, and that's how it is. She said, oh, it will offend because I hadn't mentioned any names. I just mentioned how the doctor was in my poem and how he gave the diagnosis. And they didn't want me to read it because of that. So I said, I'm reading nothing unless I can read it. Exactly. And I read it as it was. And the reaction of people in the room, they came up to me after and said, we were gobsmacked because we didn't know that that's how people felt when you got the diagnosis.
Yeah. Well done.
That says it all, really. That's a good way to finish on.
Yeah. Thank you, Captain Wendy. That seems to me this is she's just drawn us to a close.
She's had enough of us now.
Just before we pushed her off her horse. Well, if there's a big cactus anywhere near, it's for Wendy. So till next time then. I do if you can find the time and the space to actually watch the other 4 Amigos films, please do. They're on YouTube on all sorts of aspects of dementia and for all sorts of audiences. So till next time, bye.
Bye.
So I shall now turn off. Stop recording.
Recording.
Stop recording.